Let's begin with Delhi, because Delhi is actually a case where the charts show that there was some amount of improvement and taking place in the month of May, but as it is now very clear even from government's reaction, the last few days have been a bit of a concern.
Yes, and I think the big worry till about 3 weeks ago was possibly Mumbai, and I think that worry now seems to be shifting a little more towards Delhi. In fact, I mean, even though our data projections are not suggesting what the government seems to be suggesting, and the government has painted a much more alarming picture. The Deputy Chief Minister went on record to say that they are expecting the cases to be 500,000. And that's as alarmist a picture as you can imagine. And I think that kind of alarmist projection is getting backed by how even the central government is reacting to it. Because if you remember, the Lieutenant Governor just yesterday issued an order where they now want to take over India's top sporting infrastructure that exists in Delhi to be converted into COVID hospitals. So obviously, Delhi is looking at a bigger problem. Delhi is also a state that is, landlocked from with three different states around them. And we've been pointing out this problem to you, to our viewers, Tanvi, that the inconsistency of the policy, even though it's a contiguous, I mean, NCR is a contiguous zone, and viruses don't respect geographical boundaries. You can, viruses will not look at the policy in Noida as any different from what it is happening in Delhi. So that could have contributed some bit to it as well. Delhi is also a large pass-through state, and that could have contributed as well, because a large number of movement of people from other states to, say, the other states like Uttar Pradesh or Bihar was happening via Delhi. And all of those factors could have been a big factor. Also remember, Delhi and Bombay are the two biggest ports of entry. So there are issues that can be about contact tracing and all. The big worry, Tanvi, that I see for Delhi is that the government has pretty much now admitted that it is impossible to do any kind of contact tracing anymore. And now they've gotten into this spat over the jargon that one should use, which is about whether there's a community spread or not. For me, the fundamental questions is that let's assume that there is a community spread now, because it's impossible to trace 500,000 cases. But for that, we need to have a policy which is much more robust in terms of testing. It has to be more robust in terms of isolation and containment zones. And we need to be more careful about what we open up. I mean, in terms of the public places, while you open up for economic purposes, the non-economic public activity possibly needs to be reined in for a little bit more than what we seem to have done as of now, Tanvi.
Yes, in fact, let me also bring in Mr. Javed Mansari for some more insights into what's happening in Delhi. Mr. Ansari, the charts also, show a very interesting story where we are now only seeing, a sudden increase which is happening around 25th to 27th May. It looks like things were coming under control. The recovery rate was actually improving and going to be surpass the active cases rate. But that's not happened. It's suddenly just turned, something's changed in the last 10 days. What's your own sense of how this is being handled in Delhi?
Well, it's been handled very badly, and it's been handled very badly by the center and very badly by the state government. They seem to be at odds despite their public posturing. There's utter confusion at the top. And look, the opening up was out of economic compulsions. And because we've opened up, we are now suddenly, after 2.5 months, everybody's out on the streets, and this kind of community spread is happening. The government is fighting shy because perhaps they don't want to admit, and they don't want to trigger off a kind of panic amongst the people. But the fact is that all of us who are living in Delhi are now on tenterhooks. There are not enough beds. Delhi is hardly testing 2,000 to 2,200 people every day. I mean, which is pathetic with such a huge population. 2,000 is not even a drop in the ocean. We need to be testing so much more. The Chief Minister went on record to assure us time and again that he's made arrangements, that Delhi has made arrangements for 4 times more than the number of patients that it would have. What we realize now, the rude awakening, is that actually we haven't even catered for half of that. There are not enough beds, there's not enough testing, and the citizens of Delhi, I'm sorry for sounding alarmist, but this is, I do believe that I'm echoing popular sentiment in Delhi, that the citizens of Delhi have been left to the mercy of the gods.
Okay, that seems to be a sentiment that has been echoed by many in the last few days. I actually just want to also read out a bit of a data to our viewers to drive home the point that sometimes what happens is that the numbers go up and down because of your testing policy, because of the way the numbers are getting reported, and some of these differences that we see in our charts also comes through. For example, in Delhi, 5th June, 6th June, 7th June, on a daily basis, in this month itself, they were reporting above 850 cases, 855 cases, then 918 cases, and 896 cases. Suddenly on 8th of June, the cases dropped to 587. Now, this was the day that the Delhi government actually tweaked their testing policy and asked the labs to not test asymptomatic people, which was then later on, a day later, overturned by the Lieutenant Governor. And then if you see on 9th of June, again the cases went up to 831. Vinay, before we move to the other cities, quick comment from you even on this. There are a lot of what we see, and we need to emphasize on this to our viewers. We are only putting out the data that the governments give us, and a lot of this data can actually depend on when they reveal the data to us. For example, yesterday the Delhi government didn't report it till late night. It only came this morning. How much of testing they're doing, the drop, the ups and downs in that as well. It's basically the numbers that are being declared by the government.
Yes, and I think the Delhi government has been a little confused in the last 3 weeks or so whether they want to play a boxing match with the central government or they want to be a doubles partner like a tennis game and act very cooperative. They started off by attacking the central government. The Aam Aadmi Party spokespersons adopted a very vitriolic and hostile tone in the way they were reacting to various measures, and then they suddenly became conciliatory. This isn't the time to do politics, and the government actually went public to create some kind of a public referendum kind of a mood in Delhi, where they started asking questions and people to respond on whether we should open up or not, and then started giving solutions accordingly. They even went to the extent of saying that if Delhi has faced such a huge crisis of loads, should people from outside Delhi be prevented from getting a bed in Delhi, which obviously again got overturned the next day by the Lieutenant Governor, purely because it was constitutionally and legally untenable. Now, that kind of confusion was possibly avoidable. This is not the time to do all of this. As Javed was rightly saying, you needed a consistency in the policy. Delhi is a large state. We all know it's a landlocked state surrounded by different states. And you know that this kind of problem can happen. The anticipation of the problem was the key, which is much the same we saw in Mumbai, Tanvi, for instance, where the governments did not anticipate it and prepare and use the strict lockdown phase of the first 45 days to build that infrastructure. Delhi should have done that. They should have done that earlier instead of now scrambling around to look for stadiums and hotels, as they're now talking about, to be converted into hospitals. Because there are more than one stories that are now going around in Delhi where people are running from pillar to post and going from hospital to hospital and not finding a bed, even though the much publicized and much touted app seems to suggest that the beds are available. So there has been a mismatch, and there has been a little bit of politics that has kind of derailed the fight against corona in Delhi. Tanvi.
Yes, and in fact, I wanted to talk about the healthcare infrastructure part in these cities a bit more, and we will come to that, because fact of the matter is these are the cities with 60-70% of the caseload of our country, but they don't have the 60-70% of the health infrastructure available in our country. They have far lesser, which means that there is a bigger challenge, which is what Vinay was referring. So we'll come to that. But let me just bring in Dr. Giridhar Babu, Professor and Head for Life Course Epidemiology at the Indian Institute of Public Health in Bengaluru. Dr. Babu, many of us are extremely intrigued by how Bengaluru has been an outlier in this. They have had far, fewer cases than any of the other big metros, and almost every other metro is struggling with the same kind of problem of high density slum area. Becomes difficult to control it, to test it over there. The public health infrastructure becomes a problem. What has worked for Bengaluru?
I think what has worked in Bangalore is that from the beginning, Bangalore has implemented exactly whatever the Government of India guidelines had laid out. If it was sealed down, if it was locked down, it was perfectly implemented to the point in every place in Bangalore, number one. But even before that, what Bangalore did was something called retrospective contact tracing. So when the first case came to India at that time, Bangalore did one new thing where for the last 1 month, they found out all the international passengers and they tried to identify who among them have symptoms and then followed it up. In addition to this, Bangalore has also has the advice of expert groups, which are meeting mostly 2 to 3 times in a week. So with all these inputs and by strict implementation, the key here, Tanvi, is that during the lockdown, we had the opportunity to do containment, which means you do active surveillance, find cases, so that you don't allow the infection to spread across many people. I think that was done very well in Bangalore. There is no different model, this is no difficult model, but we have done well only because we have followed the rules and regulations really well.
Yes, in fact, because Bangalore would also be one of those cities that did see a large number of people coming from abroad initially. A lot of business executives who travel a lot. There was quite a bit of movement, and so in the initial days there were cases. I think what Dr. Babu says, makes a lot of sense to the fact that if you don't do your contact tracing correctly in the initial days, and then don't implement your lockdown rules properly and allow violations to take place, then it becomes a problem. In fact, let me bring in Dr. Anand Bhan also in that. Dr. Anand Bhan, as we look at different cities and see how Delhi is struggling and in fact seems to be headed towards a worse situation. Mumbai is in a bad situation, but it does look like it may improve. Chennai is a case where every few days we see a spike, and situation going out of control. There is a lesson to be learned from Bengaluru, but can we do that now? Can we go back to implementing a stricter lockdown, because now we're seeing a larger number of cases?
Sure. So thank you for having me. Whether we should be implementing a lockdown, I think is something certainly which is an option on the table. But I think the lockdowns are only useful if they're effectively implemented and used properly. If you're going to just think that lockdown is going to be a solution in any way, it's not going to happen. So I mean, whether Bangalore, whether many other parts of the country, especially the northeast, down south Kerala, places like Bhilwara, etc., which use the lockdown measure in terms of implementing contact tracing very well, and then ensuring that you isolated those cases which were positive, then you are going to be using a lockdown measure properly. If you are going to just implement a lockdown and not do anything else, or not do other things well enough, then you're not going to be able to have any success with controlling the spread of infection. So I think the lessons which are to be learned are not just the lockdown, it is also what do you do within the lockdown period, right? So, and how do you effectively use your public health infrastructure, your staffing, your outreach activities, your community engagement, working with the healthcare infrastructure, ensuring that everyone is following guidelines, that you have clear data available, that actions are done based on that data, and that information is transparently made available to the public so that there is public trust. Now, if you do this concatenation of efforts, then I think it is still possible for any city to be able to try to address a crisis situation that they might be facing. In fact, there is no alternative. The alternative otherwise is status quo and waiting for actually, the number of cases to keep on rising and keeping on planning and saying that, well, we are now prepared for 75,000 bed requirement, then 150,000 bed requirement. Where will we ever stop unless we actually try to put in our preventive measures? So I think that, no time is late enough. And I think now, even with the situation worsening in a few of our mega cities, I think the municipal corporations, the state governments, and the central government all need to work in conjunction with each other, which, as previous panelists said, we have sometimes not seen. So that is really disturbing that, you have governments which are saying things which are not, which are not speaking, not seemingly speaking to each other or in variance with each other, and that does not augur well for an effective response. So hopefully we will start to see more cooperation and more clarity of response, both at the local level as well as the state and national level.